I've been studying homeopathy and practicing homeopathy for 20 years now, since I was a young GP in Cornwall when I first started doing the course in London. And it was amazing, really, that even with that limited amount of experience in that first year, that I could help so many people with such basic knowledge. I helped young mothers with terrible premenstrual syndrome, children with recurrent infections, men with recurrent herpes infections, cold sores. And it was inspiring to me how, in addition to my medical knowledge, how much homeopathy contributed to my work as a GP. You know, everybody needs a good GP. My husband is a GP, and I don't see homeopathy as an alternative to general practice. I see it entirely as a complement to general practice, because there are many, many things for which doctors in general practice and in hospital medicine have little to offer. And if I'm thinking of, you know, recurrent nightmares, sleep problems, severe anxiety with panic attacks, people with chronic fatigue syndrome, people with recurrent infections. There are some medical options, but they're not necessarily getting to the root of the matter. They're just treating each individual attack, but not actually seeing what led to that, how that person's health has got out of balance through the combination of experiences. And I remember when I was a junior doctor, patients would tell me stories. They would say, "I've never been well since that happened to me," or, you know, when this symptom goes away, that symptom gets worse. These, what we call in homeopathy, these alternating symptoms. And I realized that there was a lot of information that people were giving me that I had no way of making sense of as a conventional doctor. And that's where homeopathy has been so wonderful for me, that I can use all that information. Medicine now has become so super specialized that if you mention a gynecological problem when you're at the dermatologist, they'll say, "Well, sorry, that's not our field. You know, you'll have to go and see the gynecologist." But I love homeopathy in that it takes everything into account, and we can really look at the whole person. Well, one of my special interests in homeopathy is the treatment of chronic fatigue syndrome, or ME, and I've seen hundreds of patients over the last 19 years. And I find that, you know, if I see 20 patients with ME, I'll give them 20 different remedies, because that's how different their condition is and their stories are. Yes, they've got the same diagnosis, but when you go into how that ME started, what their symptoms are, you see 20 different pictures emerging. That and the treatment of inflammatory bowel disease, Crohn's and ulcerative colitis, those are my special interests. But the beauty of a homeopathic clinic is that you see so many different conditions, and I would say recurrent infections, so recurrent cystitis in young women, recurrent chest, ear, throat infections in children, asthma and eczema that are responding poorly to conventional treatment, recurrent herpes infections. Those are just recurrent migraines. Those are just some of the conditions that spring to mind as, you know, kind of bread and butter conditions that homeopathic doctors treat.